Welcome back to The New Health, and back with us again today is Dr. Heather Gessling, direct primary care physician in Missouri. Thank you so much for coming back with us today, Dr. Gessling.
Oh, thank you. Glad to be here.
So today we would love to discuss the topic of patient autonomy. So first, I would love if you would define what patient autonomy is.
I define patient autonomy as the ability for a patient to make all of their own medical decisions without fear of retribution or without this misunderstanding that they're beholden to somebody else or that they have to obey an authority. They are their own authority.
That's a wonderful definition. I love that definition. And advocating for ourselves, being able to make decisions for ourselves. And we do know that when patients do that, when they advocate for themselves and when they have their own buy-in for their decision making, that their outcomes are better. Is that correct?
I absolutely know that has to be true. I haven't seen a specific statistic or study, but there is no way that that's not true. It's super important for patients to feel like they are in control of their own body. They're their own primary care provider. They are the one that is ultimately responsible for their own health and decision making in healthcare.
So do you find, and you find as their primary care physician, that you have a partnership with your patients?
Oh my gosh, that is exactly right. Yeah. And even before I was doing direct primary care, that's how I practiced is I wanted to give the patient all the information that I had in my mind. And, that may include even financial information about the cost of certain tests or informed consent about pros and cons about test or treatment and be able to just discuss all of that information and then have the patient be a part of that decision-making process. I think we should say gone are the days where you walk in and a physician tells you what needs to be done or what they recommend and you feel scared of not following that recommendation either for treatment or diagnostic testing. You need to know all of the information. There has been such a lack of informed consent in mainstream medicine, whether or not it's from prescribing medications or injectables or vaccines, or whether or not it's from recommending certain diagnostic tests and the use of contrast. All of these things need to be discussed. We can't blindly follow a physician's recommendation.
I think we've fallen into a space with the insurance-based model where there's so little time spent with patients that it's really hard to get buy-in, but it's so necessary to get a patient's buy-in to agree with what's going on with their own body and their own health.
Yeah, you are right. I mean, there is limited time, incredible pressure to get a patient buy-in. And so there's persuasion and maybe some sort of bias or propaganda speech, that, oh, it's all fine. This isn't going to cause any problems. This is well researched. All of these terms that get used for patient buy-in, but patients need to do their own research.
So, and when patients do, when they have their buy-in, then they're in this space where we're aware that you can have better outcome. But let's talk a little bit about the placebo effect, even when it comes to autonomy. I know people may be aware of placebo effect. If you'd like to describe that a little bit with us.
Yeah, so there is this well-researched idea, and there is evidence to show that if a physician says, I'm going to give you this medication and it's going to produce this effect, whether it's an antidepressant or even something for pain, then when the patient takes that, whether or not it's the actual medicine or not, they receive that effect. So that just shows the power of the mind to be able to help with symptoms in your body, whether it's pain or inflammation or mood. The power of the mind is incredibly strong. And this is one of the reasons why we can argue against the use of a lot of pharmaceuticals, because it's not the actual medicine itself that may have the most dramatic effect, but it's your mind. And there's a book called The Biology of Belief, where it shows that you can have such an impact on how your body, the epigenetics of your body can be turned off or on just by what you're thinking. It has a powerful effect.
So I'm so glad. I love that book, The Biology of Belief by Dr. Bruce Lipton.
Mhm.
One thing that I think it's important to talk about when we're talking about patient autonomy, when people don't feel like they can advocate for themselves and they can't make the choices for themselves, it's not just about placebo effect, but there's the nocebo effect, which is the opposite of that.
Which is one of the reasons why patients should have such strong support in being able to say no. Because if they have negative feelings in taking a certain medication, they're gonna do poorly with that medication. They're probably going to be more likely to suffer the list of side effects, like truly feel it, or not get benefit from that medication. If a patient is told by a physician, you have to take this medication, whether it's for cholesterol or whatever, and the patient feels stress thinking about taking that medication, it's gonna cause them harm. We don't want patients to feel like they have no choice, that they just have to follow the doctor's order. There should be discussion, there should be alternatives, there should be recommendations that the patient feels comfortable with.
I believe even stepwise before pharmaceuticals, there are other things we can do. You have the time to speak with your patients about what those things can be. And then some of those medications, you read the laundry list of side effects with them, and your mind may have you have some of those side effects just because
That's
you've read
right.
that list.
Yeah, I mean, that's exactly right. There is such a powerful effect of the brain on how your body presents certain symptoms, or the effect on the mood, or the effect on pain in the joints, or the effect on inflammation, or the effect on blood sugar. It can all have direct correlation to what their thoughts are.
The power of the mind. It's so incredible.
Yeah.
So let's talk with our audience about how we can help them exhibit some of this patient autonomy. I mean, we know that patients are in a fearful space. Tell us what the limitations. Why aren't patients willing to express autonomy, first of all?
I love this question. I think in society we've been brought up over the last several decades of sort of this idea of authority, and you got to do what you're told, be a good person, don't rock the boat, clean your plate, do what you're told. And this can happen in any aspect of society. It can happen within religion, it can happen in the home, it can happen in the medical industrial complex, so the mainstream medical system, where you're labeled as non-compliant or difficult, if you don't do what the physician tells you, or if you question things, or if you want more information, or if you just make a decision that you don't want to do that medication, or you don't want to have that test run. It's like the physician can literally treat you different. I've seen it. I saw it in my training. I've seen it in my career, where patients get labeled as difficult just because they don't feel comfortable doing something that the physician has recommended.
So when we are in that spot, because I think a lot of people, I have a mindset, I'm a medical provider, you're a physician. It's always a good idea to have someone in medicine in your family, right? So you have that advocate who can go with you and play the bad guy so you can still be the good guy, but not everybody has that. So how can we help people with the words that will be helpful for them to not be that problem patient, the person who is seen as a difficult patient?
I recommend staying positive if you're in a situation where you don't feel comfortable with what's being recommended. I recommend to use some diplomatic terms, such as, let me think about that, I'll get back to you, or I'm not saying no, but let me just do a little bit of my own research, or I would like to give it some time. Maybe we can readdress that at the next visit. Terms like that.
How about the idea of are there any alternatives? Is there something I can try first? I'm not comfortable with a medication right now. I'm not sure I'll even be able to take that medication regularly. I'm scared of this. I need a little time.
Those are even better.
So
I highly suggest, if a patient can push back against starting a pharmaceutical, then by all means, you should say, I'm not ready to start that medication just yet. Are there other ideas or alternatives before we do that?
okay, I think that's great. So it's the feeling comfortable or trying to feel comfortable understanding you're not going to be defined as a problem patient. Having the
Mhm.
words that are maybe more feeling words in there of, I'm a little concerned about this, let me think about that. I know we can get a little scared with providers if we don't know how to advocate for ourselves, but buying yourself a little time till the next visit, asking for possibly an alternative that you can use instead of the pharmaceutical or the test or whatever might be next. Even asking the pros and cons maybe about doing a test versus not doing a test.
Yeah, exactly. I mean, nobody is in charge of you but you. You do not have to submit to anybody. You just have to do what's right for yourself.
That's perfect. I love the topic of patient autonomy. I'm sure we've given some ideas for people in our audience that can then take this information with them into their next appointment, hopefully empower them a little bit more for their own health and well-being. Thank you so much for joining us again, Dr. Gessling. Could you please let everyone know a little bit about what you're doing right now and how they can reach you?
Yeah, I would love to. I'm doing a detox project with my good friend Christian Elliott, and we're going to be doing our next free 2-day seminar in September. You can sign up at www.healingunited.today. You got to put that whole web address in there. Also, if you're in the state of Missouri and you're interested in seeing what my clinic has to offer you, my direct primary care clinic, you can go to my website at gesslingfamilywellness.com. I'm on some social media sites. You can get me on Twitter or X at @Gessling. I'm also on Facebook, Heather Gessling. I'm also on Instagram, but I don't know what that handle is. I think it's Heather Gessling MD.
Thank you so much. So yes, if you're in Missouri, definitely you can see that Dr. Gessling is your patient advocate partner for you. So please reach out to her. I'm sure you will really enjoy working with her. I wish I was in Missouri. I'm in Michigan. So I would love to be there with you. So thank you so much for joining us once again. And I'm happy that you're going to be back with us again next week. And for those of you watching, please stay tuned after these messages for our next guest.